good morning, everybody. I'd like to thank the HitLab team for the tremendous job that they've done and for inviting me to speak here. I was given a choice of two topics, and I thought that this one would actually resonate because it's on trend these days, as you can imagine. So, as we all know, value-based care has been getting a lot of attention. Some of you may be well aware of its implications, but thought that to start the day off today as we try to advance topics around women's health, that we do an overview and some of the critical considerations of its success. So, those of us that have been in healthcare for years and years know that the foundations in which we integrate innovation, integrate policy changes, et cetera, that changes. It changes due to politics, it changes due to the whims of the public and the needs of the public, as well as changes in regulation both at the state and federal level. This constant moving foundation has created quite a bit of challenges and poor performance of our healthcare system. Though we have one of the most innovative and impactful healthcare systems in the world, it's clearly not perfect and it doesn't work for all. And we're constantly having to iterate and prop it up. Now, value-based care, and there are many ways to describe that value-based care, but today I'm going to talk about the cost model and the payment models primarily. It actually provides an opportunity for a very, very strong foundation for our healthcare system. And the reason is, traditionally, the way our healthcare system has been dispensed is where there is a payment for a particular service. A patient walks into a clinic, and the clinic gets reimbursed for that service delivered. We're moving to a system where the payments are actually more associated and incentivized around outcomes and patient satisfaction. So there's a motivation in the value-based system to actually coordinate care and focus on the not delivery of a specific service, but actually the delivery of health and health outcomes. Now, this has the promise of creating better health for all of us. The idea is that if you're incentivizing better care and outcomes, that you will actually achieve the goals of reducing the cost of healthcare, because a lot of the metabolic diseases, a lot of the diseases that are driving the cost of our healthcare system would actually decrease as people get healthier. And this promise has been realized to some extent in a few different examples of healthcare. The idea of value-based care has been around late 90s, early 2000s, but it really started getting momentum. And what people were realizing was that this promise actually needed support from the government and scalability. And in comes the ACA. And what we have in 2010, that bill, that act actually is made sea changes in our healthcare system. But there are two particular areas that I want to highlight here when it comes to value-based care. Value-based care wasn't actually getting tremendous support either at the federal level, local level, or in the payer system until the ACA. And there was a very important aspect of that, and that was the testing of models, of value-based models. The other important aspect was actually having in Medicare incentivize reduction in cost and comprehensive care for patients. That led to more modeling and more programs being rolled out at the federal level, and here's just a few examples. And in 2015, there was actually awards and bonuses, now part of CMS, for the delivery of care. And so what we see here is that our system now is incentivizing outcomes and incentivizing patient satisfaction at a level that was not there before. Now, this is what's happening at the government level. Things really took off around 2019 when Harvard, a group at Harvard actually published results from Blue Cross and Blue Shield's experimentation in value-based care. And what was tremendous was here you had a private payer actually showing significant success in terms of cost savings, more importantly, but also in the outcomes of their patient. This study actually, what you see is the controlled group is actually a set of patients that were in New England, not just Massachusetts. And when you look at the Blue Cross Blue Shield cohort versus Massachusetts and New England, clearly there's savings and clearly there was performance in terms of better health outcomes. Now, things are not all rosy. As other companies and other payers and systems started implementing value-based care, there were some significant challenges that became quite evident. And these challenges, I think, for most of us here in the audience is pretty obvious. First is inefficiencies. Clinics, doctors' offices are very much inefficient. Yesterday there was talks of faxes still being a dominant way of communicating. We have manual data entry that's still the dominant form of data entry that's burdensome for physicians. And we also have lack of interpretability of patient data. So as there is a move to integrate care, the data for the patient actually has to be moved around from various providers and various networks. And that's actually something that's been very difficult in our system to deal with. Patients also are challenged with patient engagement. If we are going to provide better health and deliver better health, we need patients to be engaged, to actually show up for appointments, to sit, to pay attention, to absorb the material, and go on with their lives and integrate that information and the changes and recommendations that their care providers are making. Care coordination, as I mentioned, is also a challenge, not just due to the interpretability of the data, but also to the communication between the care providers. And then you have the big challenge, of out-of-clinic care. And this is something where it's not just compliance with the use of medication, but a big set of issues with psychological and lifestyle changes that are needed to accommodate better outcomes. Now, I strongly believe, and in my years of experience consulting in digital health and innovation, what can be measured can be managed. And this is where digital innovation can actually reign supreme and shine. So all of these issues that we're having can actually be addressed by digital innovation and digital solutions. Now, since all of those challenges could be addressed, we have the potential to live in a digital utopia of healthcare. We have telehealth currently that's being widely used. By some estimations, over 60% of the US population now have engaged with some form of telehealth and are quite happy with it. That engagement, we have remote digital monitoring of biometric indications, and we have even ways of digitally monitoring compliance with medications. The challenge with this vision of utopia is that there are foundationally some discrepancies or differences, for lack of a better term, in which the impact of our healthcare system is employed in this country. So because today is focused on women, because I'm a woman, African-American woman standing before you, I just give two examples here. So women, by and large, are 20% more likely to report not being heard by their physicians. They are 22% less likely, to be recommended elective surgeries such as knee replacement, and they are 8% more likely to die of heart failure, which was actually data that's surprising because there's the assumption that heart disease is predominantly male disease. Black women, the numbers are even more stark. 22% actually, compared to white women and women of European descent, are more likely to die of heart disease. and 71% more likely chance of death from cervical cancer, and over 200% more likely to die from complications related to childbirth. The disparities are dramatic, absolutely dramatic, unacceptable in a society such as ours, and it's a challenge for our healthcare. And with this utopia that digital health and value-based care is promising, the hope was that these disparities would be significantly mitigated. But as they say, something funny happened on the way to the forum, in that as these models were being tested by the federal government, what they found was that not only were these disparities in healthcare not mitigated, they were actually exacerbated. And they were exacerbated in the sense that they became implicit and structural bias. So the three examples that were highlighted in some of the reports here were which biomarkers and the limitations, the limiters set by the model coordinators actually discriminated, and so Blacks were disproportionately removed or not included in these models. Excuse me. Now, realizing that this is a big problem, CMS and HHS put together a panel and put together a report for Congress to remedy the situation. The goal of a lot of these efforts with Medicare and Medicaid was to actually deal with disparity, deal with what they call social risk, and it was very clear that the value-based models that they were putting together was not dealing with that. So there was a study to create recommendations, and the recommendations are, surprise, surprise, measure and report quality of individuals who have social risk, and also create fair and high standards. These standards have not been established. The modes of measurements and the recommendations for measurements have not been clearly set. So there is opportunity for everyone here in this room and out who's watching today as influencers, as innovators, to actually impact these recommendations that will be going to Congress and actually setting forth the standards for which value-based will, at least at the federal level, be implemented. The idea is to reward outcomes, and so to reward outcomes, we need there to be good measurements and good standards in terms of the implementation. And if the adage that anything measured can be managed, then there's a role for digital innovation to be there. Now, as I mentioned, we as innovators and supporters of innovators are very much in line with solving a lot of the problems. It may not happen today or in a few years, but I'm confident that all of those things on the left there will be addressed. Now, the things that are hard are actually on the right. These are called the social risks that were referred to in the HHS CMS report that I presented earlier. The interesting thing about innovation is that it can perpetuate bias, as that was discussed yesterday, or it can actually alleviate. And we're probably going to end up with a combination somewhere in between. And the way innovation can actually alleviate is to actually not just look at these gigantic, enormous problems, such as socioeconomic position. What app, what algorithm can deal with that? It's too big a problem for any particular solution to solve. So what I actually recommend is that we start thinking about the idea of life features. Rather than social risk, let's look at individuals, look at patterns of individuals' lives, and see if we can find solutions for those. Now, the drivers of disparity are pretty clear. There's biology, there's bias, and there's social risk. Biology, biopharma, medtech, they're dealing with that. We're, again, going to have years of development to get to the goals, but bias is something that is a bit harder. But we think that innovation can provide a solution, and I'll show you some examples of that. As long as it's able to be detected, we think it can be managed. Social risk, on another level, is very, very difficult, and that's to be determined. Now, I mentioned bias we think we can handle. Here's an example. This is some work done University of Wisconsin and UCSD groups. What they've done is actually used recordings from between patients and doctors that, I have to hurry up here. They've used recordings from patients and doctors that actually measure components of bias, and they score them. And what you can see is differences in this diagram between patients over time, and you see some stability. So now we potentially can measure bias and potentially associate those biases with outcomes and patient engagement and compliance. But what about telehealth services and other aspects that don't seem to be working in our system? What's interesting is most women, in a study where they looked at patients' preventative service and outcomes from telehealth versus in-person, it showed that telehealth did not have significant improvements in outcomes for patients. Why? We're making things more convenient, more robust. If you're a woman with kids, you can imagine why. Most of the technology and innovation and approaches aren't meeting people where they are. Our life features actually matter in us executing healthcare for ourselves. Lives and the differences in our lives, space, time, and support are all things that need to be addressed as we navigate healthcare. So the question posed here is, can digital solution, can innovation actually detect and engage and measure what's happening in the home, in people's lives, to actually impact how they engage with healthcare and their outcomes? So to close, the potential for value-based is tremendous, and the two things actually potentially hurting its impact or mitigating its impact is the inequitable delivery of care and social risk and life features, and we believe that innovation could address these, though it may be difficult. We need a better foundation, and the reason we need a better foundation is because all lives matter, and I just want to share quickly a point here. This gentleman in the center is my father. He passed. He passed because he had an outpatient procedure and his blood pressure was not detected. He bled internally unknown to us for 4 hours. I was the one who had to tell the nurse to check his blood pressure when he did not seem to be responsive. My aunt died this year. She went to the emergency room twice and was told to go home. She went again. She never left. She passed away. Myself had some abdominal pain. I was told it's not significant, it's just monthly cramps. 2 days later, I was literally crawling into the emergency room with a ruptured fallopian tube due to an ectopic pregnancy. Our lives matter, and the way healthcare is administered and the care and attention that individuals get is important. And so I ask you all, as innovators and influencers, let's make value-based care count and let it be the opportunity that it is for better care for all. Thank you.